So, look, there is frustration here rooted in the financial strain that so many people are feeling, but also in the psychological strain, right? Of having to ride this roller coaster up and down over and over again. So, what's helpful and what's not? Well, joining me now, clinical psychologist Dr. Vivian Lee in Toronto and Dr. Raymond Abdulrahman in Winnipeg. Hello to the both of you. Dr. Abdulrahman, maybe I'll start with you. The mixed messaging that we heard about in Peter's piece, of keeping businesses open, but being told to stay home. What is the effect of that on how tolerant we are of the natural ups and downs of a pandemic?
Well, uncertainty is probably one of the worst things for our mental health. It leaves us unable to plan. It leaves us unable to manage our feelings. And COVID on its own has already provided enough of that. And when the messaging on how we need to be responding to that is also uncertain, you can imagine that the level or the impact on mental health is significantly greater. And it makes people's ability to follow the instructions worse.
But Dr. Lee, if the goal is to have people act with greater urgency, isn't that made abundantly clear every day? The numbers sort of make that case, right? Is that registering in your mind?
Well, we certainly see the increasing numbers in the headlines every day, but I think unfortunately that might be part of the problem. It's kind of like if there's a fire alarm being set off in your office every single day, there's that urgency at first, and then after a while you start to tune it out, even if maybe one day you start to smell a bit of smoke. So I think we've become very attuned and numbed out to the rising numbers. And there's a lot of cognitive overload. We have a lot more just to keep in mind day to day. If I'm going to the grocery store or taking the bus, there's a lot more I have to keep track of and be aware of day to day.
Right.
So I think we're being inundated and overloaded.
So Dr. Abdulrahman, what would be a better way then, if not hitting people over the head repeatedly with the numbers?
Well, I think relatability is critically important. I think the tone has become agitated and the message less clear. And both of those are just playing into the nature of COVID in and of itself. If we have inconsistent messaging or inconsistent reinforcement, people are less likely to do what we need. I do believe strongly that we need a greater sense of relatability in leadership. Leadership has to recognize what the everyday person is going through in order for that everyday person to be able to agree and hear that message. If the message is agitated, people are less likely to follow through. And if you have a physician or a psychologist who you don't relate well with, is demeaning or a bit agitated, you're less likely to follow their advice.
And so, Dr. Lee, then, let's talk about leadership. We heard Ford's tone, which I would say today was measured, sometimes appealing to a sense of hopefulness, but clearly also, I guess, dangling this threat of lockdowns. Is that effective in your mind?
I think if used too much, it loses its effectiveness. It's helpful occasionally to see, the human side of our leaders and, to see that they're also struggling at times with this. And to know what are the consequences going to be if things don't improve. But to use this kind of heavy-handed approach and, wagging your finger, it's not always helpful. People tend to tune out, especially when we're hearing that very often. I think if you think of inspiring leaders, people who have led through, very difficult times in the past, what do? They stay calm. They project confidence. They're empowering in their speech. They inspire people to want to follow them, and they're showing that empathy and compassion while also being very clear in why they're choosing to do different things.
Dr. Abdulrahman, we see in your province of Manitoba a much stricter lockdown. Does that backfire? Does it make people feel like they have no options, like they're backed into a corner, or is it precisely what people want? They want clarity. They want rules.
Well, it's interesting. I don't think the lockdown has been as clear. The messaging has been inconsistent. And I think it speaks to the frustration and the human nature of our leaders as well, too. What our leaders need to understand is the human side they need to show is the relatability versus, as Dr. Lee said, the finger wagging. It's not been a very clear message when it comes to what the restrictions are.
Right.
I think that's leading to a lot of the problems.
Dr. Lee, maybe one last question to you. And I think back to the beginning of the pandemic, it felt to me like there was a much broader social consensus on how seriously to treat the pandemic. What would it take to reignite that feeling, do you think?
I think it would be helpful if leaders and people who have greater information in this field, if they can kind of take that team approach. If you think of a coach and his players, every player is assigned a specific role. And it's eye on the prize. You know that if I'm fulfilling this part of the role, then this is to achieve this goal with the team. And this is the same thing. I think it's reminding us, being clear in the communication of, okay, for small business owners, this is what we want you to do and why. And people who can work from home, this is what we want you to do, and frontline workers, et cetera. So I think reminding people, this is why we're asking you to do this in your specific role, and this is what we're trying to achieve as a community.
Excellent thoughts, both of you. Thank you so much, Drs. Lee and Abdul Rahman. Thanks so much for your time.
Thank you.
Thank you.